Hi everyone. Today we will discuss the use of Remdesivir in COVID. So this is an article published in New England Journal of Medicine on April 10th, 2020. They have discussed the compassionate use of Remdesivir for patient with severe COVID. So Remdesivir is a prodrug of nucleotide analog that is intracellularly metabolized into an analog of adenosine triphosphate that inhibit the viral RNA polymerase. They have initially used for Ebola, SARS, MERS, and also in vitro testing also shown some activity against SARS coronavirus too. So for patients, before giving, they have make sure that creatine clearance is at above 30 ml per minute, and also ALT and AST is less than 5 times the upper limit of normal range. And the dosage they have used is initially they have given a loading dose of 200 mg IV on day 1 plus 100 mg daily for the next 9 days. So this was the baseline characteristics of the patients. They have taken total 53 patients, and on 60 of these 34 were on invasive mechanical ventilation and 19 were on non-invasive oxygen support. And the median age was 64, and they have included patients from United States, Japan, Europe, and Canada. So 30 patients were on invasive mechanical ventilation and 4 patients was on ECMO. The mean duration of symptoms before starting of remdesivir was 11 in invasive and 13 in non-invasive. And patient has other comorbidities like hypertension, diabetes, hyperlipidemia, asthma in 36%. So this was the information of total 53 patients, and this the last day of remdesivir. You can see this black line represents the last the 10th day of remdesivir, and this red one is patients with ECMO. You can see the 4 patients with ECMO and their follow-up. This blue one shows improvement, and this one no change, and worsening indicated by the dark one, and death is denoted by this black square, and discharged by this diamond shape. So all this patient with in ECMO, in this 2 patients showed improvement, and 1 patient is still on ECMO. And in invasive mechanical ventilated group, these patients had worsening, and then all next this patient the condition was same, and this much patient show improvement. You can see the color change from the red to the faint one. As the improvement occurs, ECMO they have ventilation they have converted to NAV, then high flow oxygen, low flow oxygen, ambient air, and this much patients were discharged. So coming to the calculations, out of 34 patients who were in invasive ventilation, there is improvement in 19 patients, that is 56%. So on non-invasive 7 patients, there were improvement in 5 patients, and 1 death and 1 patient went to invasive ventilation. And low flow oxygen group and ambient air group, there was 100% improvement. This is the improvement in oxygen. This was the baseline oxygen support, and invasive group the oxygen support oxygen requirement was the improvement in oxygenation, and non-invasive group showed much improvement in oxygenation. And this is the age-wise improvement in clinical improvement. More than 70 years, 50 to 70, and less than 50. So less than 50 years group showed more improvement compared to other group. And this is the overall clinical improvement we can see with the use of remdesivir since the days since the initiation of the treatment. And what are the side effects? Major side effects include multi-organ dysfunction, septic shock, acute kidney injury, and hypotension. And adverse effect minor like hepatic enzyme elevation and acute kidney injury. So they have concluded that in hospitalized patient with severe COVID, 36 of 53 patients, that is 68% showed improvement with use of remdesivir. So we need ongoing randomized placebo control trial for further data. Thank you.